Healthcare providers in the tri-state get ready to vaccinate more children against COVID-19. Thanks for joining us tonight. Hello, I'm Brad Bird.
And I'm Shelley Kirk. The CDC approved the Pfizer vaccine for 5 to 11-year-olds, making millions more eligible to get their doses.
Some healthcare providers already starting or will start this week. And tonight's top story, Eyewitness News' Mike Pickett is live outside Deaconess Gateway in Warren County with the latest on this. Mike?
Brad and Shelley, starting tomorrow, Deaconess officials say parents will be able to take their children that are ages 5 to 11 to either Deaconess Gateway or to their Henderson location to get their first dose. And yesterday's decision by the CDC also has schools watching very closely.
A lot of parents, a lot of families have been waiting for this for a very long time.
For parents with kids in the newly approved group, the time is now.
I was waiting for this decision. I'm excited because I already gave all my other kids the vaccination, so we think it's going to be a very safe and wise decision just to protect them at this age.
Perry County Health Department officials say they started administering doses to 5 to 11-year-olds today. And Dr. Capri Wire, the medical director for primary care at Deaconess Health, says 500 appointments were booked in the first 16 hours after yesterday's announcement. Doses will start being administered tomorrow.
So it tells us that a lot of parents were anxious and they feel the urgency to get their children protected, especially with the upcoming holidays.
28 million kids across the country now eligible to get vaccinated through the Pfizer vaccine, which is 2 doses, but at smaller amounts compared to those for people 12 and older. School officials in Evansville, Owensboro, and Hopkins County, Kentucky say they're watching to see how the vaccines impact case numbers.
While nobody loves wearing masks, we're going to do whatever it takes to keep people safe. We are very pleased to see the numbers coming down both statewide and locally, and we're going to continue to track those.
Dr. Wire also tells us that children should be fine to get both the COVID-19 and the flu vaccine around the same time because recent studies have shown that there are no major complications that happen to those who got them on the same day. Live at Deaconess Gateway, Mike Pickett, Eyewitness News.